My name is Peter Rollerson, and I'm talking to you from the FIP conference in Seoul, South Korea, 2017. And with me is my guest from Canada, John Papastergiou. Now, John, you're concerned particularly in Toronto, and you have a project that you've been starting up there. Tell me about it.
Yeah, I'm based in Toronto. I own 2 community pharmacies there. What we found in my pharmacies is we were getting a lot of patients, and I think no different than in any other pharmacy, that would come in with very generalized GI symptoms, burping, bloating, discomfort. And we thought, we have a multi-ethnic patient population. Do we have an opportunity to test for H. pylori? I've always been interested in point-of-care testing. I think it's very easy to implement in pharmacy practice. So we put together this quick pilot program where we're able to test for H. pylori in the community pharmacy.
Right. Now, how do you select your people for doing this?
So I mean, we have a selection process that we put in place. Generally, it's based on symptoms. Yeah. We also have exclusion criteria, which are very important. So if patients have alarm symptoms for cancer, we would exclude them. If they've been previously tested or treated, obviously we would exclude them. Yeah. But if they've never had any tests done, they've just been trying to treat themselves with over-the-counter medications, we'll offer them a test. And what we're finding is pretty interesting right now. But just over 20% of patients are testing positive.
That's very interesting. Now, how is the test done?
Very simply, it's just a finger prick, not much different than a blood glucometer.
Right.
So what you do is you draw a little bit of a blood, we pull it up with a lancet, and then we take the blood, put it on a strip, very similar to a glucometer strip, and then it runs. It's an immunoassay, and we're looking for H. pylori antigen.
Right. And how successful is it?
The accuracy is very good. Sensitivity, specificity, very high, over 90%. Right. So we're very confident in the test. You do have to make sure you get enough blood, and that sometimes can take a little bit of a skill. But beyond that, it's very suitable for use in community pharmacy.
Right. You get a result. What happens to the patient then?
So then that's important. So as pharmacists, if we're doing these tests, we've got to be able to manage the patient after we get the results. So generally what we'll do is if a patient tests negative, then we continue to try to manage them with OTC medications and see if we can get their symptoms under control. For that 20% or so that's testing positive, what we do in that scenario is we'll reach out to the physician. We have a good relationship with the local physicians in our area, and we'll get them eradicated. So usually we put them on an HP pack, and then we'll follow up. It seems to be working up to this point.
Now, what about the cost of doing this?
Very cheap, surprisingly inexpensive. The assay that we use is cheap. It's $3 or $4 a test. We're not charging the patients right now within the confines of the study. We do charge for other point-of-care tests in my pharmacy. It depends, but around $20 generally we'll charge. But for this test, we're trying to recruit patients. We're just absorbing the costs, and we're more interested in the results right now.
Good for you. Now, is this going to expand? Are you going to do it elsewhere and hope for the rest of Canada?
Yeah, I think so. I mean, the results, we're here at FIP presenting the data, and it's pretty positive. And what we're finding is based on the ethnicity or the place of origin of the patients, the positive rate it could be much higher. So patients from Africa or Asia are testing much higher than the 20%. So I think we're getting an idea of who we should be recruiting into the study as well. And, if the results remain this positive, I think we'll reach out for some grant funding and maybe try to expand it.
And how do the doctors react to all of this? Great
question. Any pharmacist that's looking to do testing like this, very, very important to build or develop a relationship with your physicians. I wouldn't advise just starting to offer point-of-care programs without having established that relationship. But generally in my practice area, there's about 8 or 9 family docs that we work with very closely. They're familiar with what we're doing, and they're supportive of it, and we're getting everyone on therapy.
Well, here's wishing you good fortune in your project.
Thanks, it was great meeting you.
Talking to me, John Papastergiou, and my name is Peter Rollerson here at FIP in Seoul, 2017.